I would like to invite Dr. Suranga Dolamulla, who is the main actor of this event, and he is a Wellcome Trust Senior Research Fellow, University of York, and of course I know him when he was the Regional Director of Health Services, if I remember correct, Hambantota, and of course he invited me for a seminar which we conducted for the pharmacy owners in the district. About 200 people participated, and he was very much keen in the subject of pharmaceutical regulation. So we are very happy to say that he has developed his career, academic career in the administration over the years, and we hope that in the future, when we are not around to manage health services, it's people like you who will be taking over the health of this country. Over to you, Suranga.
Head table, ladies and gentlemen. It's really, my presentation is for the healthcare financing and the regulation in the antibiotics, antimicrobials in Sri Lanka. While he's taking the connection, I will just give a little briefing about today's presentation. It's really, the first part is for the history and how the Sri Lankan registration helpful for the AMR, and the second part is really the economic aspect, how the Sri Lankan healthcare system is geared to providing the universal health coverage. And finally, I just want to have a discussion with you regarding how we should provide the services, how we can increase the access and the financing mechanism to combat again antimicrobial resistance. I am very much comfortable at this moment, since most of my points have been discussed by the earlier presenters, especially the intervention of the antibiotics and the problems of the antimicrobial resistance and their repercussion and consequences and future challenges. Everything has been discussed in this forum. And for me, I think just to mend around with the slides, and let's see how it's going on with that. The first one is the penicillin inventor, the Fleming. In his Nobel lecture, he warned about the penicillin resistance in future due to the misuse and the underuse. And within 2 years' time, the first penicillin resistant case was identified. And this particular slide was really discussed about the economic burden and the health burden. Where I just want to emphasize on the economic burden, where the cost is nearly the 66 trillion US dollars in 2050 only for antimicrobial resistance. That is not the indirect cost, only direct cost. Then when you add indirect cost, it's more than this. And when you get this cost, it's more than the current world economy. Therefore, you can understand, if we are going to face this problem in 2050, how much of money we should utilize to combat this antimicrobial resistance. And I think previous presenters, they have touched upon the national medicinal drug policy for Sri Lanka. But I just want to emphasize one more thing. Even though it has 10 key elements, especially the essential medicine list, and thereafter they talk about the accessibility, the affordability and equity and the quality of the drugs. But the important part for us, how we can fight against AMR, where we can have the collaboration between education, agriculture, animal husbandry and even the pharmaceutical industry to make the coalition. And that's a biggest positive point from the national medicinal policy. Professor Sanjo has nicely elaborated about the Sri Lankan key role in development of the WHO essential list of medicine, where the former RD, Dr. V.T. Gunaratna from WHO Zero, he gave the massive support in terms of the legislation to get EML list into the action. Even Sri Lankan government, they have given the legislation support, even economic support, as well as the lobbying in the regional countries to promote essential list of medicine. This particular slide is really explain about the antibiotics in essential list of medicine, where number 6.2 is for the antibiotics, and you can see the number of antibiotics available in here. Not only here, all other section of the list contains antibiotics. Therefore, we can see enormous amount of antibiotics. Today we are going to talk about whether it increase the access or whether it really par with the excess of the medicine. And this is one of the key point for my particular discussion, the national strategy for the combating AMR in Sri Lanka. It has 5 objectives, but the 5th objective is very much important. It really describes about how can we make sustainable financial solution, the development of the new vaccines and investment of the prevention and research, where we can get the data for the making a sustainable financial solution. The final part, really, I just want to give a little introduction about the economic framework of Sri Lankan government, especially how the financial system is managed. The government really earn or get money from the general taxation and other revenues, and they pool into one place. From that, they purchase some services and goods to provide into the general population. That is the normal way of the providing the services and the goods. It's really adapted from Thomson 2009, and it's really all over the world. This is the normal concept, and some developed world is little different from us. When you discuss about the health expenditure, I think everybody is aware about the total health expenditure of Sri Lanka. It has been varied from 2.5 to 3.3 or 3.5 from whole GDP for last 10 years. And comparatively, the UK, they spend more than 8% from their GDP, and America, USA, they spend nearly 16% of their GDP for the health sector. But it's quite different. They are really wealthy countries. But I think we have spent insufficient sort of money to give a free healthcare services at the point of delivery. Whereas the government portion varies from 48% to 50%, and most of the money spent from the central, nearly 66%, being utilized by the central government, and the provincial government takes action for only 1/3 of the money. The interesting part is the out-of-pocket expenditure. When you search about the literature for last 20 years, it really indicates the out-of-pocket expenditure in Sri Lanka is high. It's more than really 42% of GDP, and sometimes it indicates about 45%. It's a huge amount. And with this, I have a discussion with you, and it's really I just want to get some inputs from you. How can we make a sustainable solution in terms of financing and enhancing the sort of accessibility, and how can we provide service to the general public where we can really achieve the universal health coverage, and where we can get a solution to combat antimicrobial resistance.